Good morning and welcome to the workshop. And I'd like to thank the Academy for inviting me to participate in this important workshop. My name is Melissa Bondy, and I'm the chair of the Department of Epidemiology and Population Health at Stanford. And I'm also the associate director for population sciences in the Stanford Cancer Institute. First, I'd like to define how CDC considers a cancer cluster and how it should be investigated. Their definition is that you would expect greater numbers of cases compared to a similar setting, similar related cancers linked to the environmental exposure of what people are exposed to, that it occurs within a group of people defined by demographics such as sex, race, and age, and it's also limited to a geographic area such as a census tract or a zip code, and it occurs over a defined period of time. It's been the responsibility of health departments in the particular state and territories and of using cancer registries. The assessment could include consultation with the community, and additional information would be gathered at that time for analysis and defining the specific geographic area and the time frame concerned using spatial and temporal methods. Most often, environmental samples are collected to confirm the exposures. As you can see, there's many types of risk factors associated with cancer. So studying a cluster makes it very difficult because of these competing causes of risk, including lifestyle and recreational exposures, occupational exposures, genetic predisposition. But what also must be considered are some of these confounding factors, such as demographics, which is race, ethnicity, birthplace, and specifically social determinants of health, which are variations linked to extremes in income, extremes in education, and also access to medical care. There are precedents for confirming environmental clusters and that they have occurred. And these are listed here. There was some specifically in Fallon, Nevada, which occurred in 2000 to 2001. And there were 16 cases of acute lymphoblastic leukemia in children where they expected less than one case to occur. And this was Fallon, Nevada was a military site where there were thousands of diverse visitors. And it was determined that it was probably due to a viral etiology. Others have been exposures to asbestos, where it's caused mesothelioma. There was an example in Libby, Montana, which was a small town, and there were tailings of asbestos containing vermiculite that caused mesothelioma in that community. Others, there was several in Turkey, where they were also exposed to some exposures in the local stone, where there were clusters of mesothelioma in both people and sheep, and others in Greece. And then there was the nuclear disaster that occurred from Chernobyl nuclear accident, where they identified localized thyroid cancers in young people who were exposed to nuclear fallout. There's been some other recent examples that have not really panned out to be cancer clusters. This was the Toms River, where people were exposed to hazardous chemicals that were uncovered in barrels after 30 years. And they thought that the groundwater was contaminated and that there was a cluster of pediatric diagnoses that occurred. Unfortunately, there was no confirmation of this, and later, even studies in rats did not confirm this exposure to be a confirmed cluster. More recently, there was another report of a town in Colonia High School where there was students and staff, and it was reported that there were over 100 cases of brain tumors of people that were either students or worked at this particular school. It has not yet panned out to be a true cluster. Others that people are probably very familiar with was Love Canal, Woburn, Massachusetts, and Hinckley, and these were subjects of films of civil action and the Aaron Brockovich film. And these were also examples of cases that did not turn out to be a true cancer cluster. So how do we find the causes of a cancer cluster and determine whether this is a real cancer cluster or not? The sources of information from the community and confirmed with clinical information with health records must be conducted. A mechanistic confirmation from laboratory studies is critical. Animal studies, although they're not like humans and difficult to extrapolate from animal studies, but one should look at the literature to see if there's been any association of of exposures and cancer causation in animals. Exposures could be different types. They could be airborne, waterborne, they could be viral, as like some of the examples I just showed you. And we want to look at the epidemiologic patterns. Are the natural observations are difficult, but we need to confirm these epidemiologically. Obviously, there's multiple exposures, as I just showed you, different causes of lifestyle factors and others. And when we estimate, these doses are approximate. And this could happen by chance, that the cluster could be biased and that it could be a chance occurrence. So there's many challenges that the residents have to be exposed to carcinogens at some dose. They have some added risk, cancer risk, because of a potential exposure in their community that they're concerned about. The challenge is to see if a measurable and unambiguous increased risk has occurred, and that's the whole purpose of investigating these cancer clusters. And we must examine individual cancers and individual tracts of where they reside. And we have to rule out whether the association can't be explained by bias. So what are the problems in assessing cancer clusters? It's really demography, not geography. And we often hear it's all about the zip code of where you live and social determinants. So we want to look at age, sex, ethnicity, lifestyle, income, education, occupation, medical care access. And often there's errors in the diagnosis or the attribution of the specific cause. People don't really understand what types of cancers they had, if they were metastatic, and there's often errors in the diagnosis of what people think they may have had, but it may not be a true diagnosis. There's errors in the census estimates in terms of determining our denominator, mixtures of different types of cancers that are occurring in these areas. And we also have to look at residential history, and people could move in and out of different areas. And so we can't really estimate their true exposure sometimes. But then again, is this a chance occurrence? The more multiple comparisons we have and we're looking at, the more likely that we could find a positive finding just by chance. So the number of comparisons really matters, because as we have more comparisons, the chances are that we could find more cases. So if there are 100 neighborhoods, we would expect one by chance. If there's 1,000 neighborhoods, maybe we would expect 10 cases. And if there's 5,000 neighborhoods, maybe we would expect 50 by chance. But then again, if it's your neighborhood, none of us want to think it's by chance. So we often think of this phenomenon when we look at clusters that it's a Texas sharpshooter effect. And this is where we aim, shoot, and then draw a target. And you can see that we could draw the target around different areas, and it would just be looking at a wall with the bullet holes, and the person investigating could just keep on drawing these targets around these areas. But it's really not a real cluster, but it's this effect that we've called the Texas sharpshooter effect, where you draw the target around where you think maybe this cluster is occurring. So how can we improve on our assessments? And this is a time when the CDC is trying to reevaluate their policies and guidelines. And one of the some of the things that are really important is that this is a public perception when they think that there's a cluster in their community. They have fear, and that these fears in the community need to be addressed by working with the community groups to gain their trust during the process. The CDC and public health entities should provide educational materials and fact sheets so that the community is aware of what's going on, how the clusters being evaluated, so that they can be more at ease about these perceived cancer clusters and what to expect during the process. And it's also important to report back the results after the cluster's evaluation has been completed, explain the findings, the statistics and what they mean, the exposures, and what they identified as the exposures. And if it's a true cluster, then that should definitely be communicated to the public, as well as if it isn't, exactly what was done. If there is a disaster in a community, like we just heard about the Palestine train disaster, it's critical that this could turn into a cluster later, that the community outreach and monitoring should be launched so that it can be evaluated and monitored from day one. But also what's important is public health agencies should work with minority serving public health entities and address concerns in environmental injustice in many of these communities where there's highest exposures and concern about cancer clusters. Thank you, and I'm open to answering questions after we complete the rest of the session.